Hi, folks. Today we are fortunate to have with us a gentleman who I've known for quite a while. He's a friend, colleague, and mentor. And I'm going to read your official title right off of LinkedIn. So if I get it wrong, you need to update your LinkedIn.
Okay, sounds
This
good.
is Ed Le Cara, PhD, DC, RN, MBA, ATC, and CSCS. And it'd be great if you gave us a brief breakdown of most of those, although I've talked to people in the or I've mentioned in interviews before my MSCS and what that was all about. So probably they don't need to go too much into like the CSCS, but and also I have never mentioned this to Ed before, but Ed, you were one of my inspirations for going back to school and getting my master's during COVID because all of your academic achievements obviously show, you know, an uncommon level of commitment to the fields you choose to study. But beyond that, um, it shows a real commitment to a passion for staying on the cutting edge of these areas that are developing so quickly, and it shows a commitment to wanting to provide the highest quality and excellence of service to those you support and help. Yeah, so that helped me, thinking about you. And I had no idea how you managed to get through all the coursework, but and still, manage a full-time job. But maybe you can share a little bit about that too. So I would like to, let's see, just go to right to the questions that we talked about. Okay, so would you tell us a little bit about your background, current role in promoting and facilitating movement and sports performance in your professional work, and how you charted your path?
Sure. Well, thanks for that. That was really kind. Sorry, I I made you feel guilty to go back and get a master's. There's a lot of work, but
It's all
congrats.
right.
That's awesome. Yeah, it's been a long, it's been a long road. You and I are not exactly spring chickens anymore. It all started off, I was a combat medic in the Army. Never saw combat itself, but worked in emergency department and got the training and, did all that. Primarily motivated by, just uh, I like challenges. And so, I was 18 or 17, I guess, when I enlisted and I wanted to learn some medicine. And I thought I was going to go to medical school. And so that was kind of a path that I chose. Um, my junior year, I wrestled. I was a Division I wrestler, captain of my wrestling team. And my junior year, I was already studying exercise science and was already doing some personal training at 24 Hour Fitness, and had already sat. I hadn't sat for it yet, but I was pretty close. I was preparing for the CSCS back then, and I tore three out of the four ligaments in my knee while I
Oh,
was
boy.
competing in college. Um, and it totally changed the way that I thought about what medicine is, especially Western medicine. Um, I was told I had to have surgery. I had no choice, but that would have made me forfeit my senior year of eligibility
Mm.
because back then they really didn't let people come back earlier than a full 12 months
Oh,
after the surgery. I tore my knee up December 30th, 1994. By the time, it rolled around that I was going to have surgery, swelling was down, it was ready. It was a month and a half later. So I would have completely forfeited my senior year. So I don't know if you remember him, Gary Ogden, who I practiced with in Pleasanton.
I do remember the name. Yeah.
Yeah, so he was my mentor. I mean, he was the guy that I went to anytime I had a sports injury, and I remember calling him up and like, this is what I'm in, like this is what happened, and I said the only option they've given me is, really, having surgery. And he said, well, have you thought about just strengthening it and just rehabbing it without, it's a small ligament. I
Right.
mean, can you could you bypass the surgery, and you could always do the surgery later if it doesn't work. But
Right.
and even
And you'd
if you
be in better condition to go into that
go into
process
the surgery, you're right.
of
But it just
recovery.
totally changed my mindset. I grew up in an allopathic household. My mom's been a nurse for 60 years. I was pre-med. This is what I was doing. I was working around physicians in the army. Like I was in an emergency department, basically doing, procedures and stuff, because that's what you do in the military.
Right.
And all of a sudden it was like, all right, like there's other options out there.
Right.
And so I'm like, well, you know what? Let me try this and see what happens. And if worst case scenario is I'll have to go back and have surgery. Lo and behold, 4 months later with a brace, I was back wrestling on the mat.
That's
Um,
great. Fantastic.
it totally changed the way that I really started to think about what what health is and what encompasses health and longevity. And I knew at that time that I wanted to do what my team had done for me, because I relied on my athletic trainer, I relied on my strength coach, I relied on Gary, I relied on the orthopedic, I relied on physical therapy, I relied on all these people. And I was like, I want to do that for athletes at the time, but also I want to do that for people too. How do I get people back to the activities that they love
Right.
as soon as possible? So I started pursuing different things. I was already pre-med, so it was really pretty easy. I just kind of switched. I did an internship in physical therapy, kind of wasn't for me. I wanted to kind of own my own business. I wanted to be with teams. I wanted to be making decisions that help teams win and compete. So back then, as an athletic trainer, we could do an internship route. I had taken the CSCS before I had graduated, so I couldn't even get my certification until I fully graduated. And so I just started working on my athletic training licensure, being able to sit for the BOC. And I was looking at Gary, my neighbor, Dr. Ogden, and I was like, this guy works 3 days a week. He sees patients, he works with athletes. I'm like, this chiropractic thing seems pretty good. Back in the,
That's
the 80s and 90s, they were making really good money. I'm like, I think I want to do that. Like
right.
direct access, no
Okay.
referrals, own your own business.
Right.
So I decided to go to chiropractic school. I already had the prereqs from pre-med.
Mhm.
And at the same time during school, I was working on my athletic training hours. I was already a CSCS. So it all kind of, meshed, it was
Right.
all kind of um, part of,
Now, did the overlaps or the adjacent areas um kind of facilitate the whatever was new material for you? Did it, was it sort of like pieces of the puzzle that made a fuller picture for
for
you?
sure. I mean, I couldn't imagine being an athletic trainer without my military background because, you're on the sideline, there's nobody else next to you, you're by yourself.
Right.
Somebody dislocates their hip or knee or ankle, compound fractures, like the stuff that have seen. I don't know without that medical background or that military medic background, I would have been mentally prepared or physically prepared to handle this thing. So
Right.
for sure, sideline athletic training was huge. And then you take in as an exercise physiology major, I had a strength and conditioning background. Like
Right.
adaptation is where all my rehab comes from. Like I don't think of myself as a rehab specialist. I think of myself as a strength and conditioning specialist that has to apply rehabilitation
Right.
protocols because most of those
Right.
people can't do what my performance people want to do. So
Right.
they've all kind of formed and since you and I have been in the same town. I've, also earned a PhD in sports medicine, have gotten an RN degree, and I'm now completing a nurse practitioner degree. Because really, what I want to be for individuals is the person that people can go to, no matter what unless it's surgical, no matter what your problem is, I can at least be an entry point.
Right.
Right, because you just need somebody that you trust that is going to do the best thing for you and not for them,
Right.
and lead you in the right way. Even if I don't do it, I'm
Right.
going to get you to the right place. I'm going to
Right.
have the referrals in place. I'm going to have those things. So if you do need a surgeon, I send you to the surgeon. If if, your primary care is outside of what I feel comfortable, treating, then I send you to a primary care that I trust. And it all comes down to basically diet and exercise because what I see, again, I've shifted and now I'm kind of back into that allopathic model. And all we learn is what pharmaceuticals do we dispense in order to treat these things. And most of my classmates think I'm the insane dude that every time I'm always answering like, oh no, this peptide treats this. We can go to a nutraceutical before we go to medication.
Right.
If we incorporate high intensity interval training in conjunction with some heavy weightlifting, we can reverse that metabolic disease. We don't need to be on metformin and four other
Right.
medications to counterbalance the side effects from that medication. So, ultimately that's my ultimate goal is that, all these things have led me to this place where I am now just a primary care provider that I can do a quick adjustment, treat your back. If manual therapy is your thing, I can rehab you from an
Yeah.
ACL.
Yeah.
I can, put you on a weight loss program. I can, but I'm seeing it from, I think, a very unique lens.
Yeah. Clearly, your exposure to those different, if not probably modalities isn't the right word, but those different philosophical approaches or those different avenues that kind of direct you in a particular um, on a particular path to get to whatever your outcome is. Both being exposed to a broad range of profiles and being exposed to different aspects and um, philosophical approaches to medicine or to, as you said, really, at a broader level, adaptation and exploiting the body's capacity for growth and self-repair. That's a really different mindset to consider all of those different pathways. And so once you've earned somebody's trust with your expertise and consistency of the support and the obvious value and applicability of the support you provide. Yeah, I mean, I'm sure people are, you earn people's loyalty for life, right?
I would hope so. I mean, I'm looking at your shirt, saying I'm not for everyone, and that's totally me too, right? Like,
Yeah,
I can come across a little bit, my honesty can be a little, rash if I'm telling you need to clean up your diet. I mean, it's like,
right,
your diet sucks, man. I don't know what to tell you. Like, you're
yeah,
breaking my heart. Like, you
right,
shouldn't be suffering this way. Um, and so I do think it's, I think people's minds are starting to change
yeah,
at least a little bit, at least the people that I'm seeing,
yeah,
because I'm 47 hours a week now, clinical hours. So
uh,
I'm seeing a lot of patients every day and every week. And I'm seeing a change. I'm seeing people not, ever since COVID, really not wanting to rely on medication, really understanding that there are other ways to treat that would happen to me back in 1995
right,
is now coming full circle that there are alternatives. And most of the time it's diet and exercise and
right,
it's lifestyle and we don't need to be reliant. No person has a statin deficiency,
right,
Um,
right,
so, and then the four medications you take because of the side effects from the statin,
right,
it's these never-ending loops that just won't stop when we could have just arrested it all with
right,
a decent diet. It doesn't have to be perfect, it's just a
right,
decent diet,
yeah,
and some movement.
yeah. And
Uh,
don't you find that if there's a particular discipline that they're, let's say, they play pick a volleyball once a week and they're trying to stay in shape mainly for that. Maybe they were like a lot of people, high school or college athlete driven fitness practitioners, as opposed to a broad, healthy, functional quality of life perspective, which a lot of us start to adopt slowly and uh, reluctantly as we get older. But let's say somebody who's got that sort of that burning passion, they still want to compete with their, their peers in their age group, and it's something that's a great, escape for them, and that they're more likely to explore that self-driven um, preventive care and seek out practitioners who are really going to light the way to not only them having a safer, more reliable outcome, but have a stronger investment in it and be, in some cases, really voraciously learning about themselves as a practical application, sort of whiteboard and soak up that, and then hopefully serve as an example for those in their circles as well. I think that's what I see sort of happening with, I'll train somebody for a while and then their spouse kind of, they express some interest or some curiosity or whatever,
Mhm.
and you know, that whole wanting to control your own destiny, but along with that, needing the guidance of a trusted, knowledgeable professional who has the attitude that you do. It's like, okay, let me take a step back. First, I want to help. Second, let's see kind of how you're wired and what you already know and what you could stand to learn. And as you said, their attitudes about, okay, well, I know I need to exercise, I know I need to eat better or whatever. Where if you can see that there's a willingness to look objectively at that and not be defensive or reluctant to kind of dig into it, their 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 applied discipline in that goes up dramatically, and they're a lot more interested in learning more and more.
Sure. Yeah. I do think in order to instill change in individuals, individuals need to be scared at some point.
Yeah, sure.
Whether that's something that's happened to them personally, they just got diagnosed with something,
Right,
they have noticed that they can no longer participate. Let's say golf is their sport and now they
right,
can't play golf because their back hurts. Whether it's a parent all of a sudden starts to have Alzheimer's, whether they start to come down with rheumatoid arthritis or some sort of autoimmune disease,
right,
that whether they feel like crap and they don't know why, but supposedly all their labs look okay and they were told that they're healthy. Something has to be an impetus. Nobody goes and buys a new mattress because they're sleeping wonderfully through the night,
right,
right? It's not like, oh, I'm going to preventively go spend a couple grand on a new mattress because
right,
eventually this mattress is going to run out.
right. Yeah,
We
sure.
might have one out of 100 of those.
Right,
Most of the time, there's a reason. There's some sort of pain point that's
right,
occurred, and wherever that is,
right.
um, because our practice is so broad, that pain point can come up many different ways, whether
Sure,
that's their first entry in is they want to get on a weight loss program, or we do a DEXA scan on them and they have low bone density and they don't know what to do except for go on medication,
sure.
whether they have a low back condition, whether they feel like crap, they have hypothyroidism, and nobody's been able to figure out how to get them feeling better. So it's like when you're offering all these different types of services, people come in, I'll call it a funnel, but it's really just wherever they fall in that practice and meeting
Right,
people at
sure.
and giving them alternatives than what they've been presented with, which haven't been working. Uh,
Right.
so, yes, I agree with you that there has been a switch,
Yeah.
that there's people are starting to look for it more because I think they're exposed to more options than they've ever been exposed to before. Who would have thought, hey, I think it's at some point right now, it's like 85% of the population's vitamin D levels are inadequate. And the correlating factor with that is, oh, by the way, colorectal cancer is way up and cardiovascular disease is way up. And guess what? Low vitamin D levels also correlate to those two morbidities. So, you know, you're, I think people are starting to get it. And I think they've only really started to get it because they've started to mistrust allopathic medicine after
Right,
COVID.
right,
And and so now they're looking for true leaders that are staying on top of, I'll call it alternative, but it's
right,
really more cutting edge, tip of the
right,
spear ways to keep us healthy and improve our longevity.
right,
And being honest with like, hey, if you can't do 25 sit to stands in 2 minutes, by the time that you're 70, you're probably going to have a high risk of fall.
right, exactly.
If my grip, if my grip strength is poor, I have a higher chance of dying early. And when you learn this stuff at 40 and 30 and 20, it makes a bigger difference, I think, than when you learn it at 50, 60, 70.
Sure.
Never that it's never too late, which is the
Right,
coolest thing about what you and
right,
I do is
right,
that we see change in 85-year-olds using, resistance tubing.
right, right,
So we know that the body is adaptable. The body is an amazing thing, but you can't just give it garbage and expect a
right.
diamond back. You gotta give a little to get a little.
Yeah, and I think it's so funny that you mentioned that because I had a very parallel conversation with a client recently. I found that once I went through my program, I I answer questions more. Well, it depends, comma,
Mhm.
and then we kind of go through context. And I try to keep it as brief as possible. But I really touched on the point that you talked about, which is it's not my intention to make you less at 65 less motivated to work hard to maintain your current level of your current VO2 max, your current strength to body weight ratio, your current balance capacity. But because there's research that shows people in their 90s and in care facilities can, can improve their strength 30%. But what's the base? What are we starting from? And what I'm trying to do is I'm trying to encourage them to stay continuous with their training, however long they've been at it already, because as the decades accumulate, your capacity is up here. So when it starts to erode, first of all, you're already up here. Second, you already live a lifestyle that exploits your physical capacity that's probably well beyond your peers. And so it doesn't come down as quick, right? And
Mhm.
so that's um, it's fascinating that you touched on that. Let me see if we can kind of bring it in a little bit more towards specifically people who are already pretty active, maybe strength train on a fairly regular basis, maybe have uh, a sport that involves cardio core balance, coordination, that sort of thing, or they have a structured um, endurance aerobic conditioning program. Um, what would you say are some of the most underappreciated or could be practiced with more consistency or maybe on a higher priority scale in terms of practices just on the exercise side? And I would like to touch on the nutrition side too, since you brought that up. And my concentration for my program was sports nutrition, and I really have a different. The fundamentals are what I went in with, but it's really has gotten fleshed out, and I look at it differently from an athletic standpoint in terms of energy balance and timing, and the fine art of managing a fairly lower body composition relative to the general population while still getting enough protein, vitamins and minerals, all the interactions, all that stuff. But first on the exercise side, what would you say people are just kind of missing right now that they or maybe it's lopsided in a particular way? Does that I know it changes from individual, but what's your general sense of that?
Plyometrics are the
Yeah,
number one thing.
pardon me.
Plyometrics,
Yeah,
plyos. I mean, even just simple jumping rope, doing ladders. I'm not saying you're doing 24-inch box jumps. I mean,
right,
you could be. But most of the individuals that are getting hurt after the age of 50 are getting
Right.
hurt because
They skip a
changing
step or
direction,
something, right?
right? Changing
Right.
direction, very fast movements that they're not used to, and so I try to incorporate as much plyometrics into my rehab programs, and then also make that part of people's warm-ups. For example, like a tennis
Yeah.
player might
Yeah.
do a little bit of jump rope before a match, might do some double leg, then single leg, jump over
Right.
the lines, might
Sure.
do a few shuttle runs, just to get the elasticity going. Because that's really
Right.
where we start to see it, right? You're dehydrated, first of all.
Right.
Everybody's dehydrated,
Right.
2% or
Right.
more.
Right.
And then you start to play, and you get dehydrated more. Now
Right.
you're an hour into your match. You have no pliability within your muscle and tendon junction, and we wonder why we snap an Achilles or we snap.
Right.
And but we just don't train that way after a certain age. And so I think if there was one thing that I would encourage is adding some jumping rope and some plyometrics into people's programs. Um, Especially if they're doing some sort of acceleration, deceleration sport,
Right.
like a
Right.
tennis or a pickleball. I mean, look at all the pickleball injuries that are occurring.
Yeah. Right.
And it's because, oh, I go to the gym, yes, I lift weights, but doing a bunch of calf raises is not the same as me sprinting to the net. Stay out of the kitchen. But
Right.
it's just I would say that that's the number one thing that I see.
Okay, that's great. I guess I didn't see that coming, and it makes perfect sense that you mentioned that. And while you were talking, and everything made perfect sense, I think sometimes people are a lot of people who haven't had a lot of experience with plyometrics, it can be a little bit intimidating because they think it's sort of it's a step function or a black and white thing. I can do it, I can't do it. You can incrementalize everything. One of the things that I do with my more athletic clients is I hook them up to a harness and resistance braid, and I'll have them, you know, do side shuffles and touch the ground and reach up in the middle.
Hmm.
And I've got an 80, let's see, 84 now year old client who's been with me. She hates to work out. She works out 3 days a week. She's been with me 28 years. If I drop dead tomorrow, she'd never exercise again. But she shows up because she wants to maintain her physical
Yeah.
functional capabilities. But you've seen the split ropes that are basically two
Yeah.
halves of a rope with, right? Okay, so I have her do split rope and do a small X pattern, left forward 45, right forward 45, right? And then once she's got that down, we bring it out a little bit. And then when she comes back to center, I have her lift her left knee just long enough so that she has a moment of true balance on the other foot. Maybe she only comes up an inch and a half with the ball of her foot. Um, she doesn't like that one because she has to concentrate too much. But I feel like that continuum where you can create sudden stress but structured, appropriate for the profile.
Yeah.
That just takes a little creativity, and it takes some reverse engineering that really most trainers can do. They just need to feel comfortable with the care team for somebody who would potentially have a higher risk for falling or
Sure.
lower bone density to start.
Sure. Yeah. No, I think that's
Okay,
great.
how about on the nutrition side? What do you think's a big blind spot?
Um, I mean, I think it's getting better. I think I think there's more awareness about the protein requirements. I think we've underestimated protein requirements for a long time. And of course, as we age, that bioavailability of protein is much less. And so you got to eat quality protein. And
Right,
I think 1 gram per every lean pound of body mass is a necessity. I just do. And not only because of it's the most nutrient dense food that we can eat, but also because if you're eating a bunch of that,
right,
it typically takes you away from some of the other poor choices.
right, right. Yeah, and one of the things that's been a really good selling point for me, pushing that with clients too, has been, they're worried about, well, if I'm eating more protein, I'm eating more food. Well, here's the thing. If you're eating more protein and you're eating a good portion, let's say 25 plus percent of your diet is vegetables, you're going to be pretty satiated and your blood sugar is going to be pretty stable throughout the day. So if you're going to tell me you're going to eat a lot more calories by upping your protein and your vegetables, my response to that is you're eating for pleasure or because you're bored.
Yeah,
It's not strictly hunger driven eating. And then that's something we look at separately, right? Once the
sure. Yeah,
composition is on point.
for sure.
Cool. Okay, so I'm going to ask you personally, how have you adapted your training and eating program over the last, say, couple of decades? And has it been more what you've learned or more just profile specific adaptations?
Yeah, I think that I was up until COVID, really, I was CrossFitting a lot. I liked it. My body was used to, because of my wrestling background, high intensity
Sure.
training, right? Like heavy weights, lots of Olympic lifting, lots of running and sprinting. Like that's just what my body is made for. My body's
Right.
not made to run a marathon.
Right.
Lots of fast twitch fibers. I lean out when I do high intensity work. So it all worked well for me. COVID kind of put a wrinkle in that.
Sure.
My gym broke down and went out of business because of that. And honestly, I just got really busy and classes were not
Yeah, of course.
fitting into a perfect time. So I went through the phase like everybody else during COVID, buy a bunch of shit for your garage and do the best you
Yeah.
can,
Right.
right? Um, And now it's been, so what I'll say is that it changes, like it adapts, like, depending on where you are in your life. And, you have to like just kind of accept it, make time for it, and figure out where it fits. Right now, what fits the best for me is I have a ARX at the office, which is computerized resistance training. So
Oh,
it's how I train most of my clients now. So you can do very, very high intensity, meaning very heavy weightlifting, in about 15 minutes, once or twice per week is all you need to do. And you get your resistance training in. And so that's how I'm doing my resistance training. I do at least two high intensity interval training on my Vasper, which is basically cooling with blood flow restriction. And you do intervals. So I'm doing high intensity interval training on that. I try to get one long zone two in, like a long walk, grab my wife, go for a long walk. Over 60 minutes. I try to do at least one other greater than 30 minutes and one less than 30 minutes, whatever that activity might be.
yeah. Great.
So I kind of put that as kind of the minimums for daily work. And then, of course, if I'm skiing, then that's extra. If I'm hiking, that's extra. If I'm, whatever I'm doing, if I'm scuba diving, that's extra. There's like certain things that I like to do now that I'm at my age, and skiing, hiking, scuba diving are pretty much it. So, other than that, I've got to do it within, kind of like four walls. Plus, we don't have the hiking in Dallas that I did when we were,
Oh,
in the Bay
right.
Area, right? So we were
Sure.
hiking. I mean, when I was at 24 Hour Fitness, we were hiking 3 days a week. I mean,
Oh,
we were like the executive team would go on a hike like all the time, meet at the CEO
sure.
house in Alamo, and we'd go.
Right. Right.
And then I would run a boot camp at the park where we
Okay.
started. Like that's how we did it a lot of times instead of being, within the four walls. Dallas, you kind of have to be within the four walls. So I'm kind of, I don't like to call it biohacking. I like to call it science to steal the quote from Peter Attia. But
Right.
I'm trying to get that work in an efficient manner and reduce my risk of injury, basically.
Right. That's great. Yeah, it's still good to talk to you again because I'm learning from you as always, but it's also reinforcing my more favored areas of focus and the rationale holds. And same thing for me. I want to continually improve the synergy of the different components of my program and time efficiency, of course. But my main driver is quality of life. My sport in high school was diving, and then after that it was boxing. And after COVID was over, I decided, and I hadn't sparred for like 12 years, something like that. I had some students I was doing some mitt work with and a little bit of light sparring. And so I went to a boxing gym in San Leandro and hooked up with a guy who was around my size in early 50s. And but he had stayed out. And I just couldn't move. I just couldn't get out of the way of the punches like I used to. I'm still in good shape, right? But the reflexes and rolling with the punches and all that kind of thing. And but I really appreciated that I kind of closed that chapter for myself on my terms. I got my He broke my nose in the second sparring session that we did. I'm like, yeah, I think that's enough of that.
I'm done. Yeah.
Yeah. Well, plus, I don't want a detached retina. I don't want a neck injury. My physicality is an important part of my being able to serve my clients. But anyway, the point is in the comparison to what you were talking about is I really try to keep in mind what I've learned, what I'm teaching my clients that I believe in, why I believe in it, and that really helps to inform the changes that I make on my own, so that I feel like I can really talk from a place of credibility on that, but also use the different reference points of any differences between us.
Sure.
Right.
Yeah.
And to adjust or incrementalize, whatever. I've kept you way too long. So let me just ask you one thing so that I can give you a chance to kind of plug. I don't have a huge audience, but this does go out to about 600 people on my email list and then my Facebook group and business page. So is there anything that you would like to share or anything you would like me to include? You're welcome to, after we get off, to send me a link or anything that I just don't know who you serve outside of your geographic area, what works for you.
Yeah, so my clinic is Body Lounge Park Cities. You can find us on social media. Me and my wife own it. It's pretty badass, whole body wellness, medical aesthetics. Um, we do everything from genetic testing to hormone optimization to high intensity interval, heavy weight training, sports medicine. We do lots of functional medicine, lab interpretation, nutritional, and basically treat lots of autoimmune because of this crappy food that we're exposed to.
That's great.
Um, and we can do it virtually too. Some
Oh,
things, not
oh,
not all. Obviously, if we have to do a prescription or something, we're limited by state laws and things. But there's a lot of things that we can do. Um, so yeah, so all my social media is all under either my name, just Ed Le Cara, or it's under Body Lounge. And yeah, I do a lot of work with blood flow restriction training because if you can't do high intensity training, meaning you can't lift heavy weights, then light weights with BFR is the equivalent essentially for strength and for muscle hypertrophy and for bone density and things. So um, I use it a lot for rehab and for people that can't lift heavy weights. So those are kind of my specialties.
great.
Peptides have been like the last few years have been a big impetus for us, like really learning how to utilize them safely and effectively. And so I answer a lot of questions on peptide use. Um, and so yeah, so that's
Great.
about it.
Well, thank you. Thank you for your time. Thank you for your patience and my my barrage of questions, but especially, thank you again. Whenever we get together, I get excited and I learn, and I appreciate you helping to broaden my horizons on this, and for my audience as well.
Well, thank you so much for having me, Dan. It's so great to connect.
It's great to see you too, Ed. All right. Well,
All right.
enjoy the rest of your evening in Texas, and hopefully we'll talk soon.
Sounds good. See you later.
Yes.